Hello everyone, this is Jonathan Marks again from Go to Health Media. This is video 4 in our series, How Project 2025 Will Change Healthcare in the United States. Today we're focusing on the impact on private health insurance. You can see the complete list of videos we are producing in this evidence-based series. Our intent is to educate you with facts. We hope you like our videos and subscribe to our channel. Thanks in advance for your support. As a refresher, Project 2025, the Conservative Promise, is the agenda published by the Heritage Foundation as guidelines for a Republican presidency should Donald Trump get elected president in November 2024. As of the creation of this video, we acknowledge Trump's announcement of his own Agenda 47. A preliminary examination of both Project 2025 and Agenda 47 reveals similar recommendations with regard to health care, so we feel confident with continuing our series focused on Project 2025. One other note. Changes to private insurance under Project 2025 have large ramifications for pregnancy, abortion, and the definition of family. We will cover those topics in video 6. A significant component of the Affordable Care Act, the ACA, passed in 2010, is its insurance mandates, designed to expand coverage, improve healthcare quality, and reduce costs. These mandates encompass a range of requirements for individuals, employers, and insurance companies aimed at creating a more inclusive and efficient healthcare system. Number 1. The individual mandate under the ACA. The individual mandate required all Americans to have health insurance coverage or face a tax penalty. The goal was to ensure a broad insurance pool, including healthy individuals, to balance the costs of insuring sicker individuals. Certain groups were exempt from the mandate, including those with financial hardships, religious objections, or specific circumstances such as short coverage gaps. The individual mandate significantly increased the number of insured Americans by incentivizing individuals to purchase health insurance. By including more healthy individuals in the insurance pool, the mandate helped stabilize premiums. The tax penalty for not having health insurance was repealed in January 2019. This is an example of a negotiated improvement to the Act as compared with repealing the entire Act itself. Number 2, the employer mandate under the ACA. The employer mandate requires large employers of 50 or more full-time employees to supply insurance that covers at least 60% of healthcare costs and not exceed a specified percentage of the employee's income for premiums. Many employers who previously did not offer health insurance began providing coverage to avoid penalties, leading to an increase in employer-sponsored health plans. The mandate improved overall access to health care. Number 3, insurance market reforms under the ACA, and we will discuss several. Pre-existing conditions. Insurers cannot deny coverage or charge higher premiums based on pre-existing conditions. This mandate ensures that individuals with chronic illnesses or past medical issues can obtain affordable insurance. This reform has provided critical protections for millions of Americans, ensuring they have access to necessary medical care without prohibitive costs. Essential health benefits. All insurance plans must cover a set of essential health benefits, including hospitalization, maternity and newborn care, mental health services, prescription drugs, and preventive services. This mandate ensures comprehensive coverage, preventing insurers from offering plans that omit critical healthcare services and protecting consumers from unexpected medical expenses. Preventive services. Insurance plans must cover preventive services such as vaccinations, screenings, and contraceptives without cost sharing. By promoting preventive care, this mandate helps catch health issues early, reducing the need for more expensive treatments later and improving overall public health. Vaccines is one example. Vaccines represent a controversial intersection between public health versus individual interests. Vaccines are mandated for certain diseases in children for school attendance, and as visible in this chart, many childhood diseases are virtually eradicated with vaccines. While vaccines are recommended for adults by the CDC, certain states require specific vaccines for specific workers to preserve public health. By contrast, vaccines are not required in either Project 2025 or Agenda 47 due to a vocal minority of anti-vaxxers and an argument for individual freedom. Dependent coverage. Insurers must allow young adults to remain on their parents' health insurance plans until age 26. Prior to the ACA, insurance plans allowed minors on their parents' coverage only until the age of 19. This provision has extended coverage to millions of young adults, providing them with a safety net during their transition to independent adulthood and reducing the uninsured rate among this age group. Number 4, Medicaid expansion under the ACA will be covered in video 5. Number 5, minimum medical loss ratio under the ACA. Insurers must spend at least 80 to 85% of premium revenues on medical care and quality improvement activities. If they fail to meet this standard, they must provide rebates to policyholders. This mandate ensures that a significant portion of premium dollars is used for healthcare services rather than administrative costs or profits, thereby enhancing the value of insurance coverage for consumers. By contrast, Project 2025 proposes deregulating private insurance markets. They argue deregulation will lead to more competition and lower prices. But this assumes that consumers understand what a product is, what it offers, and that we can shop for the best price. That's difficult in healthcare. How do you, as a consumer, tell what the best healthcare product is? How do you, as a consumer, tell what the best medical procedure is? And when it comes to our health, do we believe that a cheaper price is better? Or do we believe that a more expensive price will give us better health? It's really not practical for a consumer to pick out the best product for the best price when it comes to healthcare. Deregulating insurance markets, therefore, may not lead to better healthcare for less money. Deregulation may produce the opposite. Some examples. Deregulation of private insurers could allow them to offer plans with fewer benefits and higher out-of-pocket costs, making comprehensive coverage less accessible. Project 2025 will reduce costs in the federal budget. One of those costs is subsidies paid by the federal government to private insurance companies to help with insurance. The reduction of federal subsidies for private insurance will likely lead to higher premiums, pushing many individuals and families out of the insurance market altogether. This shift would particularly impact middle-income families who do not qualify for Medicaid but rely on federal subsidies to afford coverage. Before, we mentioned numerous mandates in the ACA: employer mandates, covering pre-existing conditions, covering young people until 26 years of age, defined and required essential health benefits, preventive services such as vaccination, screening, and contraception, and pregnancy and abortion coverage. Without these mandates, insurers may begin charging for these services or not covering them at all. This could lead to a decline in preventive care, resulting in higher long-term healthcare costs due to the increase in untreated conditions and late-stage diagnoses. In conclusion, deregulation of the insurance market under Project 2025 and Agenda 47 will not guarantee the same level of insurance coverage or same quality of health care as under the Affordable Care Act. There is no guarantee that deregulation will bring more insurance companies into the market. There is no guarantee that innovative solutions and reduced pricing will appear any more than we have already. Deregulation will encourage insurance companies, rather, to maximize profits at the expense of insurance coverage and health outcomes. As we saw in video 2, red states versus blue states, red states in general have lower household incomes and lower tax revenues. This may encourage profit-driven insurance companies to abandon these states altogether. Lower insurance coverage means people will not be able to afford the health care we need. Without proper care, we will become sicker and use emergency rooms more, presenting doctors with more difficult cases, thus driving healthcare costs up. Please like this video so more people see it. Thank you in advance. And please subscribe to our YouTube channel so you benefit from all the videos in this series. This has been Jonathan Marks with Go to Health Media.